Are you suffering from lack of confidence or discomfort due to loose hanging breasts and you want a solution for that? Then you are at the right place. Hi, I'm Dr. Preeti Pandya, Senior Consultant Plastic Surgery, Vivaesthetique, New Delhi. Today we are going to discuss about the management of hanging, loose, sagging breasts. And what is the management? It is a breast lift surgery or a mastopexy procedure. Let's just understand, what do you mean by sagging breasts? Natural breasts are also teardrop shaped, which means they are a little bit saggy at the bottom as compared to the top. So what is the difference? The difference is when your nipple areola, it goes below the level of the natural position of the breast, then it becomes a saggy breast. It can go up to the level of your bra line, which we call inframammary crease, or it can go even beyond that, lower than that, or sometimes if it stays at that level, but the whole of the breast tissue sags and the upper part of the breast becomes practically hollow, then that is known as a saggy breast. Let's just discuss now, why does someone have a saggy breast or a loose breast? A sagging breast, as known as a ptotic breast or ptosis in medical terminology, occurs due to multiple reasons. First is your genetic makeup. Sometimes it runs in families. Your mother, maternal grandmother might have saggy breasts because of a certain size or skin quality, and you might inherit those things. Number two, because of natural aging, all the elastic tissue of our body loosens, and breast is no exception. Breast also becomes loose and saggy. Third point, sudden weight loss, which is with your own efforts with diet or with post-surgical weight losses. Because of those, you lose a lot of volume from all over the body, and that includes the breast. And it sags down, deflates. Then comes pregnancy, breastfeeding, and post-pregnancy changes in the breast. The breasts, which were initially full with milk, have now got deflated once you have fed milk. So there is a change in the weight and the structure of the breast tissue. And after that, it sags down, becomes loose. Then comes your chronic diseases like diabetes, like high blood pressure, thyroid, which can give changes to breast tissue system. Also, if you are smoking, that loosens the breast tissue, decreases the elastic content of the body and also the breast. So it is more prone to sagging than anyone who doesn't smoke at all. Natural factors like naturally heavy breast will sag more than somebody who has lighter breasts. And last but not the least is menopause. Once the hormone levels decrease, then of course the breast tissue sags more than what it would have done otherwise. While planning for breast surgeries, we grade the ptosis or the laxity of the breast. Now this grading is important because the grade decides the amount of laxity or ptosis that someone has. More the ptosis, more the cutting of the tissues required, more the lifting required, and the scar changes accordingly. So, what makes you a good candidate for mastopexy or breast lift surgery? Number one, if you are really bothered by your appearance of having loose, sagging breasts or a different altered, elongated shape of breasts, then you are a good candidate. Number two, you are in good physical and mental health, and so you are fit for procedure. Number three, you have very realistic expectations of the healing time period, of a few restrictions that are required for a period of time, and you are ready to wear a surgical support bra for some time period. And you have stopped breastfeeding for at least 6 months prior to the procedure. And last but not the least, that you do not smoke. We need to see the grading of ptosis. Why do we need the grading? Because grade 1 is the level where it is minimum sagging, and as you go lower down, grade 2, grade 3, sometimes even grade 4, the sagging increases. So how does it matter to you? It matters because the amount of sag, the amount of laxity will decide the amount of lifting required. and that will decide the incision extent, and that extent will decide on the final scarring that you will have. Now we come to the techniques. There are multiple techniques which are used for a breast lift surgery. You can have a crescent breast lift, you can have a donut surgery, you can have a keyhole or a wise pattern surgery. All these technical terms are not just terms, they have their own importance. Mastopexy or breast lift surgery is done under general anesthesia. That makes it more comfortable for you. There are a few things which you need to take care during the post-surgical period. Number one, you have to have a regular follow-up with your plastic surgeon. You have to have all your medications as prescribed by a plastic surgeon. Number two, there are a few restrictions on your activities like heavy exercises or weightlifting, which you should follow diligently. Number three, you need a surgical support bra after the procedure, and you should wear it as per the advice of your plastic surgeon. There are many more things which may be required as per your individual situation. Discuss all this in detail with your plastic surgeon. If you still have any doubts or any queries about the procedure, feel free to reach out in the comment section. Me and my team will try to help you as much as possible.
Please like, comment and share, and follow us for more such informational content.